What's up, tribe? And thank you for tuning in. Tonight, it's a pleasure to once again be together. We're very grateful to Dr. Klompas and his family for making the time to visit with us and share his wealth of knowledge during these challenging times. Thank you, Rabbi and Mrs. Wolf and Rabbi and Mrs. Galernter, for encouraging this event and helping to get the word out. It goes without saying that as a community, we feel tremendous debt of gratitude to the Klompas family and all of those families who are on the front lines of this battle. We're all doing our best to stay informed and put into practice whatever appropriate precautions we can do to help save lives and flatten the curve. We really have no idea what you're all going through. We appreciate everything that you do for humanity. There's a lot of misinformation and conflicting information in this digital age. Tonight will not be a legal or halakhic analysis in any way. Encourage each person to reach out to their community and religious leaders for appropriate guidance. Tonight we will strictly be learning about the medical perspective from an associate professor at Harvard Medical and world-renowned infectious disease physician and epidemiologist at Brigham Hospital in Boston. The schedule tonight is to hear an overview from Dr. Klompas. Then we will have an opportunity to ask the questions which were submitted to us beforehand. If there is time, we can look at some of the questions that are chatted. I also just want to take a moment to thank everybody. The community has been truly incredible, and everyone in their own way stepping up to the plate and coming together to make the community a much stronger community and helping all those in need. And it's just been tremendous. So many hidden angels that deserve a tremendous shout out. It's really an amazing thing to be part of this community. So thank you all. Dr. Klompas, we'd love to hear your remarks on what do we know, what still is unknown, what do we need to know going forward, and afterwards, hopefully there'll be time for some Q&A. We look forward to hearing your remarks.
Thank you. So I'd like to thank you again very much for the opportunity to be able to talk and to share some ideas and some thoughts together. I want to actually start by picking up on one of the points that you made about there are many angels out there. And I'll go further. I'll say we are living in an age of heroes. We're living in an age where within the hospital, everybody is stepping up to the plate to do their all to get us through this crisis, to save lives, to make people healthy again. We see it every day, from the security guards to the people at the triage desk, the nurses, the doctors, the respiratory therapists, the cafeteria workers, the cleaning staff. It's unbelievable. There are heroes outside the hospital. They're the people that are caring for their neighbors. They're keeping an eye on those who can't get their essential goods. They're doing hidden acts of kindness. They're giving chizuk to all of us who are in despair, who are feeling the pain of isolation. We're feeling the distance from our friends and from our loved ones. I've been witness to an amazing amount of kindnesses personally that I've seen people do for others, that I've seen throughout our community. It's an amazing, amazing thing to be part of. And if there's any silver lining to this catastrophe, it's that. I want to acknowledge as well my wife, my children, who are the ones who got me through, who are getting me through. Work is very stressful, and to be able to come home to unconditional love and support and joy and enthusiasm is unbelievably incredible and gratifying and uplifting for me. My boy made me this pin. It says best. I don't know if that's true, but it makes me feel good, and that's why I wear it all the time. My wife says it's the age of heroes, so I'm trying to show the world this is the place I live in. Let me actually share with you one or two pictures, if that's okay with you. What you're seeing over here is the count of new cases per day from across the partners systems. That's Mass General, Brigham, and Wellesley Hospital, Faulkner. Basically account for a significant fraction of the local community. The orange line is one to pay attention to. It's the count of new cases per day by the date of symptom onset. And you can see the curve has come down tremendously. We're really down to a point where there's a much smaller count of new cases per day. And what that says is that all the things that we've gone through over the past 2 months, the physical distancing, the staying at home, the wearing of masks, the keeping apart from one another, the hand hygiene, the fastidious washing, it's working. We're getting there. We're seeing the same thing in our hospital census. The number of patients inside of our hospital with COVID is steadily decreasing day on day. We're seeing more discharges than admissions for COVID. Our ICUs are finally starting to clear out. We still have plenty of patients. Don't get the wrong impression. There still are new cases, so we're not out of the woods yet. But I just want to reassure you that everything you've been doing, all the trouble and the toil and the stress and the pain that you've suffered, it's working. You're saving lives. Keep it up. Keep it up. A few other points I want to tell you about. One of the great questions I think we all have as we walk around our community is to know, how much disease is there? We know people can be asymptomatic and yet still be A, infected, and B, contagious to others. They can pass on the infection. And so I think that sets us up a fear factor as you walk around society. Who might have the infection? Who might not? And we're getting to the point where we're able to actually quantify that. We have some data on this. And that's because we're now at the point at our hospital and those in our system where we test every single person who's going to be admitted to the hospital. It doesn't matter what you're there for. You came for a broken knee, you came for because you had a heart attack, you came because you actually had pneumonia. We're going to test you. And so we can characterize amongst those, you come to deliver a baby, you're going to get tested. So we can characterize amongst people who are not coming for COVID-like complaints, or not coming for pneumonia or the related syndromes, how many of them are positive? It turns out that number is about 1%. And that's actually perfectly consistent with what was found in Wuhan at when the outbreak first began. It's also what's been reported in Italy when they were at the height of their outbreak, and also true inside of Iceland, where they did a large national survey. So you can interpret that number as you wish, big number or small number, but it's 1%. So 99 people out of 100 who are walking around feeling fine, they're fine. The next interesting thing, I think, is that there are a number of jurisdictions that have started trying to do antibody testing, so-called seroprevalence surveys. That's a blood test where you try to work out, does a person have antibodies to the virus that causes COVID-19? And the biology here, as you know, is that when you get an infection, your body's immune system tries to control that infection by creating these things called antibodies, which identify the virus and take care of it. And so you can look inside of the population of people who are feeling fine. Do they have antibodies or not? The presence of antibodies suggests that they probably have had the infection. So there are a couple of lever points from this. But first of all, the first point of interest is how many of us actually have antibodies at this point? And that really depends on where you are. So in New York City, when they did this, it turned out about 20% of the population had antibodies, suggesting that 1/5 has had this infection. That's a remarkable thing, 20%. That's literally millions of people inside of New York City who've had this infection. And for those of us who have friends over there or family, this is not going to surprise you at all, because we all know a stack of people who've had it. So if we all know a stack of people, that means a lot of people have had this infection. And so that's sort of one measure as to how far the disease has gone. I'll say that I see it as a glass half full, glass half empty. On the one hand, the fact that 20% of the population has been infected, that's a lot of people who've got through this, a lot of people who are now on the other side. By the same token, that means that 80% of people in New York are still vulnerable. I think that injects for us a note of caution. We all know that the buzz amongst the political realm is to try to see what we can do to try to reopen society. And I think we all know it's going to happen in a gradual fashion. There will still be rules around social distancing, around wearing of masks, a gradual reopening of society. And I think that gradualism is going to be important, because again, I think those surveys tell us again that the majority of us actually are still vulnerable. So if we backslide too quickly on our social distancing, or we're not careful about wearing our masks, there are a lot of us who are vulnerable, and we risk overwhelming the medical system again. So have that note of caution. I've had a few questions from a number of people as to whether they should get their antibodies tested. It's available from urgent care centers. I think you give them some small amount of cash, they'll provide that for you. We're saying you got to be cautious about that. The reason is that there are literally hundreds of different versions of this test available. The vast majority are not certified by the FDA, and we know they vary in their performance. You can take the same person, be tested by two of these different these tests, and they'll come up with different results, which means that you're not sure which one of those is right and which one of those is wrong. And we know that all these tests have some subtlety to them, that they can be prone to both false positives and false negatives. They can give you a falsely positive reading or a falsely negative reading. That means you've got to interpret it with caution. The other factor is that we hope these antibodies mean that you have some protection from future infection. We don't know that. And so just because you have antibodies doesn't mean that you can relax, or that you can feel confident that you're not going to get infected again, or that you might not be a risk to other people. I hope it's going to turn out that the antibodies do confer true immunity, and in fact that you're over the woods, but we don't know that yet. And so we're saying you need to be careful until we have the science to be able to prove that's the case. One other caveat about it is those antibodies can appear while you still have active virus in your body. And so it can be, in fact, particularly for one of the kinds of antibodies that are present, that your DUFCA actually have the infection at that moment. So your DUFCA might be at the most dangerous point where you're able to contribute to spread the infection to others. Again, that's as a note of caution around antibody testing. We'll learn more as more and more people get it done, and we sort of do some of the studies around it, but stay tuned. The next thing I want to talk a bit about is that we're learning more and more about what are the risks for transmission. What's the probability that of a one person passing the virus to another? What are the kind of conditions under which that occurs? And I'll tell you that this is largely a good news story. On the one hand, we know that clearly this is a very contagious virus because there are millions of people who have been infected. It's ripping through the world, so clearly it has good capacities to spread. But if you wanted to quantify it, for any given person who has the infection, if you're in touch with them, if 100 people come in contact with the person with infection, how many of them are actually going to get infected? So it turns out that number is actually not too high. It's about 5%. So the risk of transmission from any one person to another, all else being equal, is about 5%. Okay, so that's good. It means 19 times out of 20, even if you're in contact with somebody who has the infection, you're going to be okay. Now, again, it shouldn't be to lower your guard, because if I'm in contact with 20 people, it's going to be passed on to one other person potentially, and they can, and so on and so forth from their circle of contacts. But I think at least I take heart in the fact that I can have a passing encounter with somebody who I don't know has COVID-19, and 95% of the time or more, I'm going to be perfectly fine. And it turns out, though, that not all things are equal. There are, as you can imagine, some encounters, some interactions with a person who's COVID-19 are more risky than others. So it turns out that the highest risk of transmission is to family members, household members. Now, if you think about it for a moment, that makes perfect sense, right? Because these are people who are in close proximity for long periods of time, touching, hugging, etc., sharing tables, food, cutlery, towels even, who knows. And so there's both more time together and more intimate contact together. So amongst family members, the risk of transmission is 20% or more. We certainly have seen many cases where it'll rip through the entire family. And so that is clearly, I think, one of the big drivers of transmission. By contrast, sharing a meal with somebody, so sitting face to face with the person, having a meal, so you might be together there for an hour, more, what have you, that has a transmission risk of around 12%. Okay, so it's less than 20%, but it's more than the 5% that is the overall blended average. Contact with a relative, 5%. Okay, I don't know what that says about the way we interact with our relatives. You can impute that for yourself. A passing encounter in the supermarket, 0.6%. It's actually pretty unlikely from that kind of encounter. Again, I take heart in this, that the majority of our interactions in society are actually low risk. And that's because, again, 1% of people is infected in general society, and the risk of transmission from any given interaction is low. Now, again, this is not to minimize risk over here. This is not an invitation to go fast and loose with your social distancing. But it is saying over here that you don't need to feel like the sword of Damocles is hanging over you at all times. Okay, that's what I wanted to share with you. I'm happy to take questions.
Thank you very much. The anxiety level came down a little bit as you were speaking. You know, just the fact that we know some more information, we have more data. It's a different visit than last time, and thank you for sharing that with us. Let's get through some of these questions. We're going to start off with the children. What is the current risk of infection for children who have not been exposed?
So children are definitely susceptible to this infection, no question about it. They do appear to be maybe slightly less susceptible than others and much more likely to have mild disease. Now, that's not to say that children cannot be very unfortunate and have a bad road with this. There certainly have been some deaths among kids. There have been some odd syndromes of. There's one that's been in the news lately about people getting inflammation of their blood vessels associated with this virus. But it does appear to be that overall they're a lower risk community, both in terms of acquisition and severity of illness compared to others.
Is there a danger currently of a child contracting COVID-19? In other words, is it something that we have to be super careful of, Or is it something that we can relax a little bit?
I want to show you some data. How about that? Take a check of this. Okay, this is Massachusetts data over here on the counts of cases by age group over here. You can see the age group that the younger people do account for a smaller fraction. It might reflect some testing bias. We might be less likely to test young kids, but overall the numbers would show that in fact all ages here, that's the blue bars, are susceptible. Pay attention over here to the red bar though, that whereas all age groups seem to be able to get this infection, you see cases amongst across the age spectrum, the red bars are the counts of deaths in Massachusetts. You can see the deaths are by far and large way disproportionately affecting the elderly, particularly those over age 70 and those over age 80. People over age 80 account for more than 2/3 of the deaths in Massachusetts. So that by far is the highest risk group, and that's borne out by these awful reports we're hearing from nursing homes where 50, 60, 70% of the population might be getting infected, and unfortunately a large chunk are succumbing and passing away because of the illness.
Just practically speaking, do you have any predictions or whatnot in terms of like summer camps this summer?
So I think we're going to have to follow the governor and the mayor's directives. They will make that decision. And I have no insider knowledge as to what they will say. Where they choose to draw the balance between allowing some resumption of normal life with the increased risk that they will confer for further spread of the infection.
If camps open up, what types of considerations should we be considering when deciding whether to send our children to camp?
Yeah, good question. I think you'll want to look for a camp that's being very mindful and deliberate in its approach to try to minimize the risk of COVID transmission. So I want to hear a camp that's having appropriately small groups and that is trying to choose activities that allow for physical distancing. That's going to be putting a strong emphasis on hand hygiene. That will not allow any kind of sharing of food. That will require kids who are of sufficient age to be wearing a mask when they're in proximity to one another.
Okay, great. And then in terms of daycare, I would imagine the same thing. What's the governor going to say? And then the same type of sensitivities to physical distancing.
Right. Remember, kids under 2 should not wear masks. Right, it's not safe. Kids between age 2 and age 5, you got to use your discretion. Okay, you don't have to force it.
Wear a mask when you can't physically distance, or that's wear a mask whenever you go out of your house?
So that's a good question. I mean, from a technical point of view, it's only necessary if you're going to be around other people. Remember that the primary benefit of the mask is to protect others from you, right? The mask blocks my respiratory secretions from being able to spread to others. So if there's nobody else around, it's not a concern. The one thing is simply about appearances, right? If everybody who's out and about is not wearing a mask, even if they're more than 6 feet apart, it gives the sense that this is not something that we're serious about. So I think you need to find that balance. I say if you're taking a walk in the woods and there's nobody else around, or you're just with your family, I wouldn't bother wearing a mask. But if you're walking down Harvard Street, even if again most of the time you're more than 6 feet away from other people, I think it's a visual message, almost like a Morris Iron kind of issue. And I would suggest that you wear your mask in that instance.
When would you say we'd be able to have play dates?
So again, I think we're going to have to follow the governor and the mayor's directive. I know that in some states the framing has been around allowing members of 2 different households to come together, so play dates with just 1-to-1. And that's not where Massachusetts has not announced anything like that yet. That's maybe a glimpse as to again a controlled way to allow for some degree of reintegration of society.
Of course, we're going to wait for the governor, but what do you think in terms of the likelihood of schools opening up in September?
I have to consult the Uma Tumim. I don't know. My guess is they will, but I think there are lots of unknowns between now and then. And again, I'm not the governor. I'm not a counselor to the governor, so I don't know exactly the way they're framing it. I imagine a lot will depend as to what actually happens over the summer. So as we go through this controlled reopening of society, do we see a big increase of cases, a steady amount of cases? We'll be fortunate to see a decrease in cases to continue. You can imagine that if we see a large spike of activity with many more cases and the hospital becoming full up again, that there'll be a great reluctance to open schools. Whereas if things go quite well, I think there'll be more openness to it.
Okay, and then in terms of, we've seen in the news, when we go back, we can expect a spike in November, and then another. It's going to be ongoing. for some time. Would you say that is that misinformation? Is that accurate? What are your thoughts on that?
I mean, my personal prediction, just to take what's worth, not much,
Yeah.
which is that yes, it will. I mean, it bears back to this point that the serological studies suggest that only a tiny fraction of society has been infected thus far. So it's 20% in New York. New York had more cases than we did, so presumably we're less than 20%. Maybe we're 10%, 15%, I don't know. And so that means that the majority of us are susceptible. The disease, as we see, is quite capable of jumping person to person. And because you can't recognize who has the virus just by looking at them, you can't recognize if you have it yourself just by how you feel, because of this possibility that you can be an asymptomatic transmitter. That to me sets up a perfect formula for transmission. You have to continue to use the social distancing, masking, and hygiene strategy, no matter who you're interacting with, because you just never know.
In terms of herd immunity, any updates on that since our last visit?
Yeah, so herd immunity, the notion that if enough of us get infected and generate antibodies, and those antibodies work to protect you from future infection, then it becomes very difficult for the virus to spread from person to person, because there's a good chance that whenever it finds another person to infect, that person has antibodies, and therefore the virus gets stopped in its tracks. What we don't know is what percent of society has to have antibodies in order to acquire herd immunity. And from other infections, we know that number does vary. In some cases, it's very high. Measles, for example, it's above 93%. For some other conditions, it might be more than 80%. For coronavirus, nobody knows the answer. I've heard speculation of numbers anywhere between 50 and 80%, but they are all speculation. So difficult to say.
Got it. Okay. I hear what you're saying. I hear what you're not saying.
But my favorite answer is I don't know, because it's usually right.
Right. Asthmatics. If a child or an adult has asthma, any special advice for asthmatics?
I think they want to be extra cautious. It's a truism of respiratory viruses that they hurt people in two ways. Through direct infection itself, causing pneumonia, so infecting the lungs and leading to inflammation inside the lungs, making it difficult to breathe, and by putting stress on the body that can exacerbate underlying conditions such as asthma, obstructive lung disease, coronary artery disease, heart rhythm problems, congestive heart failure. And not infrequently, it's the underlying condition, the congestive heart failure, the asthma, that causes the person the greater problem. So the virus is an exacerbant. It really makes things worse for somebody who's fragile to begin with.
In terms of a person using a friend's swing set, the other kids are not on it. I would imagine it's not like, the neighbors are away, I'm going to go use their swing set. It's probably a case where they are, present, or maybe they were there this morning and then there's an afternoon. A lot of people live in two families. Those types of scenarios. What would be your advice?
Good question. So what would be the theoretical risk? The worry would be that somebody used that swing set earlier in the day. They coughed, sneezed, talked vigorously, whatever the case may be, and respiratory droplets might have gone onto that piece of equipment. And if they're infected, there might be some virus present. And then somebody else comes along and they touch that same surface, and they touch the chains of the swing or the seat where there might be some virus present. And then they bring that to their mouth or their nose or their eyes, and they self-inoculate. They introduce the virus into themselves and they get infected. So that's the theoretical risk. I guess the question is, if you dissect that, what are the probabilities of each? So first of all, what's the probability that the first kid actually did spread their respiratory viruses? No, it's just even before that. What's the probability that the original kid was infected? So we said maybe 1%. What's the probability that kid coughed, sneezed, etc., and got some virus onto the surrounding area? Well, unlikely they got onto the seat, right? Maybe they got it onto their hands and onto the chain. Although I grant you, having spent many Shabbos afternoons in Priscilla Park, I know that the way my kids swing is chest down on the seat. So maybe I shouldn't discount that. And then what's the likelihood of the survival of the virus on the swing itself for whatever period of time until the next person gets there? That varies by the kind of surface. Under laboratory conditions, which is so the ideal circumstance for survival of a virus, the survival on cardboard might be about a day, on stainless steel, maybe 2-3 days. I think those are probably exaggerations compared to what we will see outside in the real world, because the real world is not optimized for the survival of a virus. So it's probably something less than that, but it's probably something more than just an hour or two. So I'd say that that would be a consideration. How long ago was the prior kid over there? And then, is it the kid's going to use it? What's the probability they touch the spot where the virus might be, that they bring it to their nose, their mouth, their eyes? And so you string all the probabilities together, it's probably quite small. But I think that the approach over here, if you have a kid who's with it enough to be able to wash their hands as soon as they finish using the swing, that's probably good enough. If your kid, like my kids, could not be reliable in doing that, a very reasonable strategy would be to take a disinfectant, just wipe down the area, and go for it.
Let's shift gears into quarantine and communal gatherings. What sorts of precautions should people over 65, I suppose we should say over 50 at this point, but the question specifically was asked over 65, many of whom have additional risk factors, related chronic diseases, hypertension, etc. What should they be doing? What precautions should they be taking? Is it better for them to stay home than to risk exposure?
In terms of what should somebody over age 65, 70, 80, what have you, what should they do? I do think they need to be extra cautious. The elderly who are bearing the brunt of the deaths in this epidemic. And so I do think that those who are above age 70, above 80 need to be double cautious. Now, I think what we'll probably see is that when the government does reopen society, that there might be different rules for different age groups. People speak a lot about Sweden, which has taken a different model to the controlling of this epidemic, where they haven't shut down all their commerce, that their stores, their restaurants, their bars are still open. But even in Sweden, even though they've allowed this more liberal model, they have still said to their elderly people to stay home. And despite that, they actually do have a very high death rate in their elderly population. So I think that we'll probably see that extra stringencies for the older population.
That brings us to the next question. There's been reported in New York that Governor Cuomo said that yesterday's updates that 66% of those recently hospitalized were people who stayed home, didn't take any transportation, are retired, unemployed. What are your thoughts on this? Is it possible that the social distancing works up to a certain point?
Right. Well, I guess we don't know what were the particulars behind each of those cases. As we said before, the real risk area for transmission is inside the home itself. So my real question for those individuals would be, who else was in the house? What were they doing? Were they possibly a means of introducing the virus into the home?
From a medical perspective, what physical setup would you feel comfortable for the following things? Communal study, social prayer groups to restart, for example, indoors versus outdoors, spacing between people, etc.
Well, I think first we're going to wait until we get the signal from the government that it's okay to resume these kinds of congregate activities. We want to know what kind of restrictions and guidance do they put upon them. And so I think that's going to be the starting point for any kind of discussion like that. From a technical point of view, a gathering in which everybody is able to reliably and consistently stay 6 feet apart, to wear their masks, to have good access to hand hygiene, to avoid congregating on the way in or the way out, or socializing thereafter, would technically be I think, safe. The one thing I would just add is the cleaning of the environment. The chair is the place where people might be touching. But again, we need to wait and see how does the government specify we want to proceed.
Okay, that would mean the chairs would have to be wiped down afterwards.
You want to wipe down the so-called high-touch surfaces, the things that are people most likely to touch. So that's the door handles. That's the table itself. Those are probably the highest risk things.
So bring your own books.
Bring your own books. That's right. BYOB.
I didn't say that. The other one is weddings and major life events.
Again, we'll have to find out what the government advises. And again, I think those will be the parameters. Can you do it in a way that will keep people reliably 6 feet apart, and that people wear their masks and do their hand hygiene, that you will not have a shared buffet with a common food source for multiple people. I think those will be the parameters. So again, I anticipate there'll be some way to be able to start to allow some component of with a great deal of control. I think the challenge for all of us is going to be to say, if we get engaged in these kinds of activities, again, once the government gives a go-ahead, how reliable are we going to be about keeping our mask on, about not schmoozing at length, about maintaining that distance throughout the entire time of being at this event, or whatever the case may be? We're just going to try to be honest with one another.
More socially oriented gatherings.
Same story. Can you do it in a way that respects these governing principles, which is minimizing distance, minimizing density, maximizing distance, following the universal masking principle, which everyone wears a mask, using your hand hygiene, keeping the area clean.
Should any of the following still be avoided, or are they fine? Kids having play dates together with kids from other families.
Talked a little bit about this one as well, is that
Right.
we wait for guidance from the governor, and we have a hint that maybe it'll be allowing just members from two different households to come together in a limited fashion. But again, I don't know what's actually going to be said.
Having guests over for a meal, just guests for a meal, maybe over, and then the next question related would be overnight guests, for people to have people stay over, and then for them to stay over at someone else's house, potentially family.
Ground rules are the same. So can you set up your dining area, your table area in such a way that you can allow a healthy measure of distance between people? The issue with a meal, of course, is that people take their masks to eat. And as we characterized before, that we said that if the risk of transmission in the general population was 5%, having a meal together might bring it up to 10, 11, 12%. So it definitely is a potential risk zone. If you do it, I think you want to try to do it while still trying to maintain some space. That means you're eating outside. I think we all are going to want to see, again, as we take baby steps towards reopening, what does it do to case counts? And I think we're going to have to titrate our response and our willingness to do these things like have prayer meetings or classes or meals together or play dates by seeing what is the actual impact on case rates. And if we see surges, then we'll know we've gone too far. So we're going to have to keep a very, very close eye on the situation, a finger on the pulse, and be willing to adapt and to recognize that we might have gone too far and have to backstep, or Be'ezrat Hashem, that will be okay and be able to continue in a controlled, limited fashion.
When should a person get tested for COVID-19? Has that changed at all? Before, it was only when the person's symptomatic. I think that was because the tests were limited in supply. Is that changing? And should people get tested if at one point they had symptoms of COVID-19?
Yeah. So the starting point is that testing should, by and large, be for people who have symptoms now, who are currently feeling sick. Last time we spoke, there was a much bigger constraints on the availability of testing, and at that point, it wasn't merely enough that you had to have symptoms. You also had to be a more vulnerable kind of a person, even a compromised elderly, underlying heart or lung disease, etc. That's no longer the case, at least in my hospital system, where anybody who's got symptoms can get a test. That anybody is welcome to do so. For people who do not have symptoms, so you're raising an interesting scenario. What if you had symptoms a couple of weeks ago? By and large, the answer is probably no. No particular need to get testing. CDC has been trying to tease apart how long is the person potentially contagious after they get sick. And for a person who has mild disease defined as not requiring hospitalization, generally speaking, it appears you're no longer contagious after about 10 days, according to CDC. And so that's their general guide, that after about 10 days, it's probably okay for people to come out of self-isolation. Let me be a little more precise about the way CDC says it. They say wait at least 10 days from the point in which your illness began, and at least 3 days after you felt better. So 3 days after you feel better, minimum 10 days from when things began. That's when they say you're free, and that's without having to get testing done.
And then in terms of it resurfacing, has there been any new clarity on that? I mean, before it was you could get it again. We don't know. Is there any clarity on that?
There continue to be a few sort of a low-level number of case reports of this happening, of people testing positive again. I don't think we have much clarity first as to whether this is just simply persistence of the original virus, or if it's true new infection with another version of the virus. From what I've seen of patterns around testing given individuals, it's sort of the characteristic that after a person's been infected, it's been a couple of weeks since they first had the infection, that there tends to be a fluctuating pattern sometimes with the test results. It makes me think that in many cases this is just residual old infection rather than new infection, but I don't know that for sure.
Okay. And then if a child is sick, should they get tested? In terms of their risk, it sounded like there was little risk of major symptoms. Should they be tested if the child gets a fever?
The real reason I think to test in that sort of scenario is really to facilitate public health control, which is that public health thinks that you are more likely to be serious about your social isolation, to extend it to all the members of their household, to potentially identify contacts of that kid who might need to be self-isolated if you know the person had definitely had COVID. And so that would be the rationale to test a kid. Again, in most cases, the kid's going to be perfectly fine. And so from a technical medical control point of view, it probably doesn't add that much information. But there probably is a public health benefit.
So in general, if someone has symptoms, it's the protocol has changed. Like they should get tested.
They should consider testing. They should discuss with their doctor. There are never sort of hard and fast rules, but I think it's worth having the conversation.
If a child has the symptoms, then the whole family is basically locked down, right? Because of the high percentage of transmission.
That's the approach that's been taken in Massachusetts, trying to encourage the entire family self-isolate because there are household contacts, and the mission right now is, part of the public health control strategy is to say that they want to be very aggressive with testing all symptomatic people so they can identify as many cases as possible to get those people to self-isolate, and then to identify all their contacts so they get them to self-isolate so they can nip in the bud any chains of transmission to try to control any one kid or one person from setting up a sort of chain reaction to spread the virus to many other people by identifying all their contacts, isolating them, and therefore stopping the transmission chain.
In order to boost our immunity, what else can be done besides exercise and getting enough sleep?
Exercise, get enough sleep, listen to your mother, listen to your wife.
Very good. And then this is a bonus question. This is like bonus round for like 1,000 points here. I don't know if you're ready for this. I don't know if you're ready for this. The Israel Institute for Biological Research said it identified an antibody that neutralizes the coronavirus. Apparently, it is mononuclear, I think, right? Monoclonal?
Monoclonal.
Thank you. I didn't know if it was a misspell. New and refined, and contains an exceptionally low proportion of harmful proteins, and it was specifically tested on aggressive coronavirus. Is this big news? If so, why is it not being reported as such? If not, why not?
Oh, gosh. I don't know. Was it from an investor? I'm not sure. I don't know. I might have heard the story. I've heard discussion of monoclonal antibodies in this condition. I don't know what influences the media's decisions to what they choose to follow or not. I will say that the world is rife with one-off reports about an amazing wonder cure, and that 99 times out of 100 does not bear out. So it's good to hear. It's good to be optimistic. Let's be hopeful. But wait till you see good, solid, hard numbers to demonstrate that the early promise is borne out.
Okay, great. Now, I just want to remind everybody that yesterday was the 28th day of the Omer. We're going to go through some of these chats over here in the chat box and try and get through some of them. If you still have steam, Doc. Yeah.
I have 10 more minutes of steam.
Will it be okay to swim in public pools, lakes, and oceans?
So lakes and oceans are probably fine because they're big. Public pools are chlorinated, which is probably fine. So it'll probably be okay. I think as always, you want to pay attention to how dense it is. You don't want to be in a small pool of 50 people, right, where you're literally within a foot or two of people all the time. Presumably inside the pool, you're not going to be wearing your mask. And so you won't have that layer of protection.
Is food being served and being inside more of a risk than being, say, outside?
Is the question, should you eat inside a restaurant or inside of a catering hall?
They're both good questions. Yeah.
What
are your thoughts on both of those? I'm sure. He's saying that if and when things go back to quote unquote normal.
I think you want to pay attention to the way that the eating area is set up. So first of all, is it individually prepared food, which I think is a necessity. I would not be eating from like a buffet kind of a situation, because I think that one person who was sick, who happened to sneeze or cough or otherwise get respiratory secretions on it, could then pass that to many people through that shared food. In a situation where it is individually packaged food, then I think that diminishes the risk. I'll take a peek at the person in the back of the kitchen, make sure they're wearing a mask. I think that would give you some further reassurance that they're being serious about control. And then in terms of the actual setup of the restaurant itself, you want to be able to have you and your family be well spaced away from others. Interesting enough, there actually is a case report of a cluster of infections was in a restaurant in China. This was set up a bunch of round tables, one family around each table. The tables were about 6 feet apart. And there were 7 or 8 tables in this room. On one end of the room, there was an air conditioner, which was blowing just across just one end of the room. And it turned out that the people who were in the line of airflow from the air conditioner on this one side of the room, 3 of the tables out of the 8, a decent chunk of those individuals got infected. from one person who had the infection. Notably, the people in the rest of that room, so the other 5 tables, were fine. And interestingly, the waiters as well were also okay. And so that kind of conveys a few things. But the air conditioner gives extra capacity to be able to carry respiratory droplets beyond 6 feet. So that'll explain how the people at the adjacent tables got infected. There is this debate that you've no doubt heard of. Is the infection carried just by droplets, or can we also carried by airborne particles, by tiny particles that are small enough to remain suspended in the air for hours and to be able to spread through entire airspace, like these pollen, for example? The fact that the waiters were fine and that everybody else in the restaurant was fine would argue that this instance that the infection was spread by droplets, not by airborne particles. And I think that seems to be bearing out, by and large, from what we've seen with this particular disease. The vast majority of infections are caused by droplets and by viruses and surfaces, not by airborne particles. And that's good. I know that people at the time said, is it okay to jog behind somebody because what if they're breathing heavily and it's going to remain suspended in the air for a couple of hours? That's probably not really much of a meaningful issue.
Okay. We have 14 new questions. They're coming in. We're going to try and get through them. I know we only have like 5 minutes, but I'm just going to throw a few out there. Vaccine, any progress on the vaccine? Pregnant women, any special precautions for pregnant women?
Progress on the vaccine. There's a wild scramble the world over to try to produce a vaccine. There are lots of candidate vaccines that are in various stages of both discovery and what's kind of interesting is that people anticipate that if a vaccine works, that will need to produce massive numbers of vaccines in short order. Some companies are actually building up the manufacturing side of things at the same time as they actually do the science of the vaccine. So that's an amazing thing. You're building a manufacturing process for a vaccine that doesn't even exist yet. The long and the short of it is that I don't think we have anything right now that we know will work. But there are certainly those who are optimistic and think that within don't hold me to any kind of number over here, within sort of the 1 year time frame, there might be something, but I think that's complete speculation.
And then pregnant women?
Pregnant women can certainly be infected, but appear to by and large to do well with infection, and that it's very unusual for the infection to be passed to the baby during the period of gestation when the baby's inside the mommy's tummy, or at birth alone. It seems like the risk to the baby is really after the baby's born, and the mommy is cuddling, breathing on the baby, etc., where the baby might get infected. The babies who do get infected, as I said before, most kids do very well. So while one always wants to do all one can to protect the most vulnerable of our society, which would include babies, it doesn't appear that this virus has a particular predilection to cause very bad outcomes. We and I think most hospitals now test every woman who comes into delivery, symptoms or not, so people get to find out their status. And if the mom does turn out to be positive, then public health has guidance around how to manage the baby. It's either have another caregiver look after the baby until the mom recovers, or if mom must provide care, that mom should wear a mask and wash her hands any time that she's handling the baby, and at other times she try to keep the baby 6 feet away.
How do the guidelines change if a person did test positive with antibodies?
Yeah, so antibodies, as I said before, we have no evidence, no proof that confers immunity, that therefore allows you to go out and about for free in society. I know that some countries have talked about the concept of immunity certificates to get out of isolation, and from a scientific point of view, that seems very premature. We do not know that antibodies, or what level of antibodies, or what kind of antibodies will protect a person from future infection.
And then travel, like family members coming to visit.
First and foremost, it's going to be contingent upon the government's guidance. When the government opens up society again in some graded fashion, what do they say about families coming together again? Will they restrict it to just people from the local area? Will they allow people to travel out of state? I'll say that New York, New Jersey is the national epicenter of this infection. But Massachusetts no slouch either, number 3 in the country, not that far behind, particularly in Boston compared to New York. So the argument that somebody from New York, New Jersey conveys substantially more risk compared to a visitor from Massachusetts may not be all that true. But by extension, I would say that you should be equally cautious if somebody from Massachusetts or New York. And so that would be a point of hesitation. So I say, let's wait and find out what the guidelines are that come from the government. And if they permit it, then I would say to do it in a slow, controlled fashion. Do not have your 10-year family reunion with 100 people from around the world next month. That's premature.
Okay, Doc, thank you so much. We appreciate your time, everything you do. And God bless you. HaKadosh Baruch Hu should bench you with Mamash Awikas Yamim. He should be put a smear on you and all the frontline workers and protect you and your family. And thank you, Mrs. Klompas. We know you're listening. Thank you so much for allowing Dr. Klompas to spend this time with us. And Bezrat Hashem, we should be together for happy occasions. Only good things, my friends and community. Thank you so much for joining us. We look forward, Bezrat Hashem, to only service to us.
Just a reminder, we are living in an age of heroes. Recognize the heroes around you. Continue being a hero yourself. Good night.
Beautiful.